All right, here we go. Hello, everyone, and thank you for attending this webinar on neuropathy care plans and compliance. Just a quick disclaimer before we get going. The information being provided is for educational purposes and it's not intended to substitute your thorough clinical decision making or your billing protocols. It's not intended to be legal advice. CPT is a registered trademark of the AMA, and every attempt has been made to make certain that the information is 100% accurate. However, it's not guaranteed. We have a lot of people listening to this webinar. Some of you are past attendees of our webinars and seminars. Some of you are members of Target Coding. Some of you are brand new to my company. So let me tell you a little bit about myself. My name is Dr. Marty Kotler. I'm the president of Target Coding. I am a chiropractor. I practiced for 16 years prior to starting Target Coding. I'm also a certified professional compliance officer and certified billing and coding specialist. That's what all those letters are after my name. And my area of expertise is in compliance as it relates to coding, billing, cash practice compliance, documentation, risk management, record keeping, Medicare, and HIPAA. And I am kind of unique. Let me tell you why. Most doctors are not certified coders. Most certified coders are not doctors. So you'll see how I combine both specialties to help you improve productivity, maximize reimbursement. I want you to reduce administrative burden. I want to show you how to get paid for everything you do. Target Coding has been helping thousands of doctors and their staff members for over 18 years with our products and services. Target Coding members, you will get a certificate of attendance. Remember to place that certificate of attendance in your billing and coding policy, just in case the coding police come knocking on your door. You could use the certificate of attendance as proof that you take billing and coding seriously and you care about preventing fraud and abuse. Members also get the playback recording, the PowerPoint slides I'll be showing, and any sample forms that I will be showing today. Okay, let's get started. Neuropathy care plans and compliance. I have another disclaimer here. Please make sure to check with your chiropractic state board or a healthcare attorney regarding the marketing materials you use for neuropathy advertising. Let me tell you why. In most states, the chiropractic scope of practice is limited primarily to the evaluation and treatment of musculoskeletal disorders. Is peripheral neuropathy a musculoskeletal disorder? Most people would not think so. So when you recommend products, supplements, clearly document and communicate that the purpose is to help the body function more efficiently overall, promote overall health and optimize health. A you're not treating a specific disease. Example, recommending CoQ10 should be documented as supporting normal cardiovascular function and overall heart health, rather than a treatment for clogged arteries. You should avoid advertising or implying that your care is going to treat non-musculoskeletal conditions such as diabetes, hypertension. When a patient has peripheral neuropathy, consider it a comorbidity, a contributing factor. Documentation should focus on how the condition affects the patient's chiropractic care rather than suggesting you're treating a disease. Okay, a little background on peripheral neuropathy. Approximately 20 million Americans suffer from peripheral neuropathy. You know what it causes: numbness, weakness, tingling, lack of coordination, muscle atrophy. It could affect anyone regardless of age. It's also very common with some age-related diseases. That means the risk of developing peripheral neuropathy increases as you get older. Peripheral neuropathy happens when the nerves located outside of the brain are impaired. One of the most common causes of neuropathy is diabetes. About 60% of diabetics experience diabetic neuropathy. So now let's get in. Now I'm going to take off my compliance hat and put on my chiropractic hat. We're going to start with the patient history, or some of you call it the consultation. You're going to ask patients questions. Actually, if you've been to my seminars and webinars in the past, you know how I like to create a breadcrumb trail. Before you even get to the history, the first breadcrumb that gets dropped down is, what does the patient fill out on their intake forms? What is the patient writing? Next step is the history. How did it start? Mrs. Smith, are you experiencing numbness, tingling, burning pain, electrical shock sensations, balance problems? Do you have a family history of peripheral neuropathy? Is the patient taking medication for peripheral neuropathy? Then we move on to the exam. You should do a very detailed exam looking for muscle strength, muscle atrophy, check reflexes, foot drop, vibration sense, coordination, any type of gait and balance test should be done. Look at the skin. Look at the peripheral neuropathy affected area. Let's say it's the lower extremities. Are there any foot ulcers, changes in the nail, foot deformities? Observe the patient getting in and out of the chair. Should you do a cranial nerve exam? Check vital signs? What about a brief mental assessment? If the patient is filling out the forms, they're following your instructions during the exam, turn your head to the right, turn your head to the left, get in and out of the chair, then you could jot down patient appears oriented to time, place, and person. However, if not that simple, it could be the patient appears to be in a lot of distress. The patient is wincing in pain. And then your chiropractic exam, you know what to do there. You're looking for misalignments, subluxations, your typical range of motion, checking for posture, palpation, muscle strength, muscle spasm, strained muscles. Now, the history in the exam refers to evaluation and management. Just a little reminder, evaluation and management documentation guidelines got a makeover a few years ago. And now the evaluation and management guidelines, documentation guidelines for your new patient codes, you should see them at the top of the screen, and your re-exam codes for your established patients are based on two key factors, either time or decision making. So time here, the time component includes things that maybe you weren't aware of. Reviewing records and tests. Maybe Mr. Taylor walks in with lab work or a report from their medical doctor, their neurologist, on EMG results or NCV results, and you review these diagnostic tests. That counts towards the time key factor for your new patient code. Documenting the encounter, speaking to other healthcare professionals, it's all included with the time. And here's the time component, or the time ranges. Up to 30 minutes is a 99203. Up to 45 minutes is 99204. 20 minutes for 213, 30 minutes for 214. Now, most of you are not using the time component. How do I know that? Because when I do my chart reviews, I spend about a third of my work week doing chart reviews for doctors across the country. And most of them I'm doing the chart reviews to prevent problems. These doctors are being proactive. About 20% of the time, the doctor's in a crisis, being in, let's say, a state board complaint, a malpractice case, or an insurance company audit. So when I'm reviewing chart reviews, when I look at the new patient exam notes and the re-exam, I very rarely see the time component listed. So what does that mean? You're defaulting to medical decision making, MDM, or I like to call it CDM, chiropractic decision making. So the guidelines on that require you to look at the charts. Here's a chart from the AMA, 99202, one self-limiting problem. So Mrs. Anderson comes in and says, I have mild neck pain. Nothing else going on. The pain scale is a 1. My lower back is good. Everything else is good. We're looking at a 202. Now, Mr. Johnson comes in and says, I have neck pain, I have back pain, I have peripheral neuropathy. There's the amount of problems. So, medical decision making is based on three elements: the amount of problems, the data to review, and the risk level. So, get these charts, review these charts so you know which codes to bill. Let's move on to the most common neuropathy related diagnosis codes. Let's start with complicating factors and comorbidities. So, again, I'm using neuropathy as a complicating factor or comorbidity, G62.9. Let's look at it this way. Patient number one comes in only with lower back pain. That's it, low back pain. Patient number two has lower back pain, also peripheral neuropathy. The peripheral neuropathy is causing pins and needles in the feet. There it is, R20.2. And the pins and needles in the feet is causing the patient to have difficulty walking. There's R26.2. And the difficulty walking is contributing to the patient's chief complaint of low back pain. So you see how we have complicating factors and comorbidities. So patient number two is probably going to need more treatment than patient number one that only has back pain. So we have foot pain, right side, left side, muscle weakness, unsteadiness on feet. Here's other neuropathy specific codes. Now, don't get confused. Just because there's a ICD-10 code for a condition, that doesn't mean the insurance company will pay for it. Most insurance companies, as I mentioned earlier, because of your scope of practice, will only pay you for musculoskeletal diagnosis codes. Those are the codes that begin with the letter M. You see that? M is in musculoskeletal. If you submit a claim with G codes and R codes and E codes for diabetes, you may get denials. Now, you should document if the patient has diabetes. You should document everything the patient has if you're going to be treating it, but you might not necessarily want to put it on the claim form to get reimbursed. Speaking of diabetes, type 2 is the most common. That's when insulin isn't being used properly, can't keep blood sugar at a normal level. Type 1 diabetes is an autoimmune disorder where the immune system is attacking insulin producing cells. So there's a few diagnosis codes. Of course, subluxation, if you're going to be adjusting the spine and the extremities, you should be using the subluxation diagnosis codes. You should see them on your screen right now. Moving along, let's talk about the types of treatment that you may be providing to your neuropathy patients. Here are some of the most common types of tests for peripheral neuropathy. Most patients, when they come to your office, they've probably been to a neurologist and had a medical examination. The MD may have ordered blood tests, may have run some other diagnostic tests like EMGs and NCVs. There's also skin biopsies and MRIs and genetic testing. Now, the types of treatment that you see in a typical chiropractic practice when treating neuropathy are a few here: nutritional supplements, laser, infrared, of course, chiropractic adjustments. So here's the first one: infrared light therapy. That's 97026. That's the CPT code for infrared. Some offices like to give the patient DME to take home, like an infrared heating pad. That's E0221. Unattended electrical stim could be billed with 97014, or some health plans require the G code G0283. Some offices are selling the patient a 2-unit TENS device. That's E0720. Laser therapy. There are two codes associated with laser therapy: a HCPCS code of S8948 and 97039, which is an unlisted modality. Now you see next to unlisted modality, it says specify type and time if constant attendance. I've seen some offices get audited by insurance companies saying, well, if you're using 97039 for, let's say, the spinalator or the dry hydrotherapy bed, well, are you providing constant attendance? In my opinion, you don't need to have constant attendance. You just have to document whether there's constant attendance or not when billing 97039. Vibration platform. There's no specific code for vibration therapy. So if a patient is just standing on a vibration platform, they're not doing anything else, that's where I would recommend 97039. And you're probably walking away, so document that it's unattended. Some offices have the patient doing a therapeutic procedure while on the vibration platform. So then you can bill something like 97110 therapeutic exercises if you're meeting the definition of it, or neuromuscular reeducation. There's a few photos of that on the bottom of the slide. Some offices provide supplements for peripheral neuropathy patients. Now, remember, just because there's a CPT code, a diagnosis code, or a HCPCS code, it doesn't necessarily mean an insurance company will reimburse you for it. However, if the patient is paying cash and they are adamant about providing them with a receipt, a statement, an invoice, so they can try and recoup some of the money they're paying you, then it's nice to give them a possible reimbursable code. So we have a lot of physical therapy, laser, vitamins and supplements, and of course, chiropractic adjustments. The AMA calls what we do chiropractic manipulative treatments, CMT. What do we call it? Adjustments or manipulation. The AMA says there's 10 regions of the body for billing purposes, 5 spinal, 5 extremity, and at the bottom of the slide are the chiropractic adjustment codes. Let's move on to your SOAP notes. SOAP stands for Subjective Objective Assessment and Plan. Let me give you a few recommendations for these subjective findings. Example, patient presents today with complaints of numbness, tingling, sharp pain in the mid-calf region, states that it's constant throughout the day. Pain level is a 6. Burning sensation primarily in the toes. Increased symptoms after prolonged standing. Good few examples there. Some examples for your objective findings in your notes: antalgic gait, postural instability, mild reduction in temperature, lumbar range of motion was restricted mildly in flexion and moderately in extension, subluxations at L4, L5, S1. A for assessment. Patient continues to demonstrate clinical findings consistent with peripheral neuropathy. Patient remains compliant with home recommendations and continues to demonstrate improvement. And P for plan. What did you do? Write down everything you do, document everything you do. We did laser, put the location, the amount of time, the settings, electrical stim, spinal adjustment, therapeutic exercises was performed to increase range of motion and flexibility in the lumbar region, specifically to the quadratus lumborum and erectus spinae muscles to improve range of motion. The exercises targeted certain muscles and were performed in a figure-8 motion on a physio ball. So you're covering all bases there. Any home care instructions you give to the patient. If you're telling the patient to use heat, how long, how much, and give the patient some follow-up recommendations. So a lot of that was compliance. Now let's move on to care plans. The neuropathy financial care plans I've put into 8 categories. Let's start with out of network. So let's say you are a chiropractor, you're out of network with the plan, a patient shows up with Aetna, Cigna, United Healthcare, you're out of network. Well, you have a choice actually. As an out of network doctor, you could accept assignment, which means the patient is not going to pay you for everything you do because you're going to wait for the insurance company to send you payment directly. So in that case, have the patient pay the co-insurance, not a copay, it's co-insurance when you're out of network for the covered services like the adjustment. For the non-covered services, the patient should pay your full fee. Your other option is to not accept assignment, where the patient pays you for everything you do: adjustment, laser, exercises, electrical stim. Let the patient get payment directly sent to them. You know, most patients have insurance. 90% of the American population have insurance. And that insurance, because of the Affordable Care Act, probably has a chiropractic benefit. So 9 out of every 10 patients that show up in your office have insurance and it covers chiropractic. So if you tell them, well, we're going to be doing services like laser or shockwave or decompression, it's not covered, it may come as a surprise to the patient. So make sure they understand your financial policies. And if you're going to be providing a package of care, which I recommend putting together a 12 visit, 24 visit, 36 visit package, it's a great way to practice. Just make sure that you're providing proper discounts. Check with your state board or a healthcare attorney, or you could check with us on that. The next category is in network. So for the covered services, you're only going to collect the copay because you're in network. You have to abide by the contract. So you're only going to collect the copay. For the non-covered services, you can collect your full fee. If you're in network with a plan, they may have a specific form that you need to have the patient sign. That is for ASH, American Specialty Health, it's known as the Member Billing Acknowledgement Form. Here again, even though you're in network, make sure the patient understands your financial policies. Medicare as a PAR provider. So the first thing you need to do to be a PAR provider is be enrolled. Then you choose PAR or non-PAR. So for Medicare Part B, if you're a PAR provider, you're only allowed to collect 20% of the allowed amount for spinal manipulation. That's all Medicare Part B pays chiropractors at the present time. Only for spinal manipulation, 3 codes: 98940, 41, and 42. All the other services, exams, x-rays, therapies, laser, you can collect your full fee, your full normal fee. Financial policies for Medicare Part B patients, you should have something called the Medicare Part B notice for non-covered services, or you could use an ABN form. Now, just because Medicare Part B doesn't pay for the exam or x-rays, you should not be giving it away for free. And then we have the fourth category, Medicare Part B as a non-PAR provider. So this is nice. Again, you need to be enrolled first. Once you're enrolled, you choose to be accept assignment or not accept assignment, or PAR or non-PAR. So let's say you choose non-PAR. Now you could have the patient pay you for the adjustment right at the time of service. However, this is where you have to compromise your normal fee. Let's say your normal fee for a 98941 is $70. Medicare, let's say, pays 45. Well, you have to accept 45. The patient can pay you right at the time of service, and then Medicare will send a paper check to the patient for 80% of the non-par fee. All the other services, you can collect your full normal fee. For the non-covered services, as I mentioned earlier, you could use an ABN form or you could use Target Coatings. Members, you have the ability to get Target Coatings member Medicare Part B notice of non-covered services. Actually, any form that I mentioned during this webinar, Target Coding members, if you need it, just send us an email and we'll send it to you. That's the ABN form, the Part B notice for non-covered services, for Medicare Advantage plans, which we're going to talk about now. We have financial policies for Medicare Advantage plan patients, also known as Part C. Now, this is where it can get a little confusing because Medicare Advantage plans, they may cover more than just the spinal adjustment. Some cover exams and x-rays. Some Medicare Advantage plans are HMOs, some are PPOs. There are hundreds of different types of Medicare Advantage plans written by traditional insurance companies like Blue Cross Blue Shield, Aetna, Humana, Cigna, United Healthcare. See all the cards on the screen? Now, if you're not enrolled in Medicare Part B, you're not allowed to see Medicare Advantage plan patients. Now, the good news is most Medicare Advantage plan patients only pay for spinal adjustments, so you should be okay getting paid for the exams and x-rays and laser for the non-covered services. However, if the Medicare Advantage plan does cover an exam, you have to accept that amount. So your normal fee for an exam could be $150. If the Medicare Advantage plan covers it for $100, and then the patient has a $30 copay, there's your $100 that you must accept, 30 from the patient and 70 from the Medicare Advantage plan. If you charge the patient 150, you got to give them $50 back. Workers' comp, well, workers' comp doesn't allow you to accept money from the patient. You're not allowed to accept money from most states on workers' comp patients. You have to abide by the fee schedule for your locality. So contact the work comp carriers that you submit bills to, ask for the fee schedule. Check with your work comp board prior to treating patients. Some states require you to register as an authorized work comp provider. And they may bundle your fees. They probably want your notes to be submitted with every claim. Just make sure you know the rules and regulations prior to treating workers' comp patients. Now you have a PI patient. Maybe they saw an ad or they came in from a promotion, or maybe they were referred to you. Patient was in a car accident. You're going to be treating the patient for peripheral neuropathy. Is it related to the car accident? For PI patients, you could have the patient pay you directly. However, most patients will want you to accept assignment, especially if the patient has an attorney. Abide by the fee schedule in your state. You probably need to submit the notes if it's a no fault state with every claim. If it's a fault state, you have to wait until your treatment is finished. You may want to send in a letter of medical necessity for peripheral neuropathy or shockwave or decompression to get authorization prior to treatment. Target coding members, if you need a letter of medical necessity for shockwave or decompression or neuropathy, just let us know. And then no insurance. The eighth and final category is no insurance. Patient says, I'm here. I want to get treatment for my back pain and my peripheral neuropathy. I have insurance, but I don't want to use it. Or I don't have insurance at all. Well, then you should be supplying the patient with a financial care plan form, which relates to the no surprise law. You're not allowed to surprise patients with a balance. You have to let them know how much things are going to cost prior to treating them. That's another form, doctors, members of Target Coding. If you want to see our sample no surprise law financial care plan form, just send us an email and we'll send it to you. Your fees should be the same for non-insured patients as they are for patients with insurance. Patient may want to get a statement, an invoice. That's fine. Okay, just a few comments here. If you've been to my seminars and webinars in the past, you know how I stress the importance of prevention. You want to avoid problems as much as possible. That's what target coding does. We help you avoid problems, prevent problems. We put a coat of armor around you. You don't want to wait for the oil light to flash on your dashboard. We help chiropractors optimize insurance reimbursement. We protect cash practices from costly mistakes. About 35% of the doctors we work with are all cash. We always want to help you reduce the chance of getting audited, not only by insurance, state boards, malpractice cases. Compliance is not an expense, it's an investment in your practice. Medicare does not have to be complicated. Many of the doctors we work with, well, we're all cash except for Medicare. We simplify Medicare for Part B, Advantage plans. We do credentialing for Medicare. We'll give you the proper ABN forms, sample documentation. Now, why have so many chiropractors chosen target coding? We work with hundreds of offices nationwide. We help you get paid faster. We help you give structure. You know, staff members, they want structure, they want organization, they want make sure everybody's on the same page. We want you to stay compliant and protect your future. We become your partner in your practice to help you maintain compliance and build successful insurance and cash practices. How do we do it? We do it through our tools, our resources, our strategies. As you can tell from listening to this, we have a lot of quality information to share. You can get it through our webinars. You can go to targetcoding.com and see our list of webinars. We have over 25 different topics. We also offer on-demand webinars. We also do every couple of months, we do a marathon webinar, 6 CEUs. We start at 8 a.m. Eastern, go to 2 p.m. Approved for 6 CEUs in about 30 states. We offer memberships. As I mentioned, there's benefits to being a member. It's only $99 to be a level 1 member. Level 2 is $299. Level 3 and level 4, you'll need to call us because we give you a customized fee based on your practice. So level 1 is only $99 a month. You get attendance to all of our webinars. That includes our CA boot camps, unlimited question and answer support. You get monthly videos and newsletters, and you pay as you go. These are our topics for our CA boot camp, 6 one-hour courses. We also do note reviews. Would you like us to review your SOAP notes? Okay, great. Send us 10 to 15 SOAP notes. We'll review them. We'll tell you what we like, what we don't like. We'll review your CPT codes, your modifiers, your diagnosis codes. We get on the Zoom meeting. We go over them with you, and you're on your way. It's normally $7.95. Right now, limited fee, $4.95. We offer 1 hour at a time. Personal coaching to address your specific situation, 1 hour at a time if you would like. I mentioned we do Medicare credentialing. Need a PTAN number? No problem. You're busy, you're hiring an associate chiropractor to come into your practice. You'll need to fill out the reassignment of benefits to your practice. You don't want the reimbursement from Medicare going to your associate doctor's home address or the previous practice where he or she worked. Natasha, many of you know Natasha. She's been with me for about 17 years. She runs the credentialing department. She's fantastic. She will do a screen share with you right on the Medicare website and show you what to do, what not to do, so you could do it on your own after our service is over. Some of you have had staff members as the contact person in your profile, and that staff person has left. It's a nightmare trying to fix that. Well, Natasha will fix that for you really quick. I mentioned that staff members want structure, organization. One of the best ways to do that is with a policy and procedure manual. That's my department. It takes about 3 meetings. It doesn't cost that much, and I'll put together a customized billing and coding policy manual just for you. You get employee training logs, chart audit tools. You get the manual emailed to you digitally, and you get a hard copy 3-ring binder. We also write HIPAA compliance manuals. There's 2 parts to compliance, HIPAA and billing and coding. We have both covered. Now, if you sign up for our HIPAA compliance program, we include the billing and coding manual. So you get both for the price of one. We have many forms, administrative forms like consent to treat minor, attorney lien forms, fight back letters, letters of medical necessity, HIPAA forms, ABN forms. I mentioned we do credentialing. I wrote a book on the best codes to improve reimbursement. This book will show you the codes that pay for the most visits versus the codes that pay for the least amount of visits. You'll get cheat sheets emailed to you with the hierarchy. I'll show you how to pair your codes in this book. That's section 2. Your CPT codes are what you're doing. Your diagnosis codes are why you're doing what you're doing. And they should pair like peanut butter and chocolate, like food and wine. There's an example. Myofascial release 97140 pairs with cervical myofascial pain syndrome, M79.12. Section 3, I put on my chiro hat, give you 25 of the most common chiropractic diagnosis codes and the subjective findings, the orthopedic findings, neurological findings, chiropractic findings to support medical necessity. You also get the excludes one cheat sheet. It's a spreadsheet that says if you code this, then don't code that. If you code low back pain, don't use strained low back muscles. If you code lumbar herniated disc, don't code lumbar radiculopathy. If you code low back pain, then don't code low back pain with sciatica. Otherwise, you'll get these weird denials. There's a sample of the spreadsheet there on the screen. We have a lot of testimonials. We have options to fit every practice. Follow us on Facebook, Instagram, LinkedIn, YouTube. I'm always uploading free videos on YouTube. Go to YouTube in the search area, put in target coding. You'll see all my videos. I just uploaded a video the other day. And here's my contact information. Email info@targetcoding.com, website targetcoding.com, telephone number 1-800-270-7044. If you'd like to fax us something, we have a HIPAA secure fax number. So you don't have to white out or black out the patient names. It's 1-844-831-2347. If you'd like to set up a free consult on this topic or any topic regarding billing, coding, documentation, Medicare, HIPAA, fee schedule, SOAP notes, scan that QR code in the bottom right corner. Or you can give us a call or send us an email. I'm happy to speak to you about how we could help your practice. So again, I want to thank everyone for attending. I hope you learned a lot. Take care, everyone. Bye-bye.